Ladies and gentlemen, good afternoon. Thank you to the organizers for inviting me. I must say that I feel a little bit hesitant to speak right now after major political developments in Central Europe, but still, let me mention some topics that are closely linked to what Tomáš Páleníček was saying. I will be speaking about the potential role of psychedelics in relieving psychological distress in cancer patients. I work at a big cancer clinic, so I'll be speaking from my experience. And of course, tumors, despite amazing achievements of modern medicine, still represent a challenge we are faced with every year. We have 26,000 deaths every year and 78,000 new cancer patients per year. So unfortunately, around 30% die because of cancer, and many of them experience depression or existential distress. These difficulties do not just concern patients in terminal stages of the disease, because cancer is a disease with uncertain prognosis, an uncertain outlook on the future. So these patients tend to be afraid of relapse, and of course their lives are difficult. They undergo many losses. They, for example, change visually, they lose their jobs, and they lose some social securities, and they also suffer from physical issues that sometimes have to do with cancer treatments. So cancer is a life-threatening diagnosis, and it can induce anxiety, depression, and other mental health disorders at different stages of cancer. And when patients are approaching the end of their lives, the specific of this situation is that they can fear death, they can be less autonomous, maybe they fear being dependent on others, they are demoralized, and they no longer see a sense in their life. They feel hopeless and helpless, and this is a very frequent symptom in cancer patients. And the question is what we can offer to these patients. Right now, the standard is that you have a psychologist in cancer clinics, but in reality, they are not there for everyone. They are not always available. For example, some therapeutic methods can support coping in patients. So this is right now almost a standard. For example, we have chaplains in clinics and people who support these patients, and we can also use anxiolytics, antidepressants, and of course psychiatrists here could tell you more about this, but as a doctor who works with patients in terminal stages of this disease, I can tell you that we can help these patients cope with their suffering, with their distress on a spiritual level, but it is not often done. So, for example, if a person was to summarize this, you can, for example, combine psychotherapy and antidepressants, but it is not always effective enough. And then there is another thing, because antidepressants are generally slow to act. We have heard about that in one of the speeches. Antidepressants take weeks to start acting, but some of these patients have just weeks of life left, so they will never see the antidepressants start to work. And also not all of these substances or the substances that are reimbursed are efficient. So, as was mentioned by Dr. Páleníček, this is problematic. In my institution, whenever there is a new thing that we want to implement, we need evidence for it to be taken seriously. For example, we decided to collaborate on the psychiatric study in order to obtain political support. We needed the support of our director, and we also needed to show that we have scientific evidence in the form of several randomized controlled trials with limited numbers of patients, but with excellent results in terms of the onset, the results, and also one of the studies that was already mentioned is here on the slide. It had really good results, and here you can see the onset of acting of these substances, and these are strong arguments for cancer specialists to focus their attention on psychedelics. And there were studies looking at the long-term clinical effect of psychedelic-assisted therapy. For example, I saw that when this was used in early stages of cancer with patients who had up to several years of life left, the long-term impact was all the bigger. The important and interesting thing is, as was suggested by one of the previous speakers, that we should not say that this is a psychedelic experience, a specific experience. It is a human experience. So respondents, patients who underwent this treatment, saw this as one of the most significant experiences in their life, also spiritually, which is beautiful. It is great to be able to offer to patients deep spiritual experiences in a safe setting. So, to sum it up, as a cancer specialist, the added value of this therapy is that it is fast acting. It is very efficient, and it has a sustained impact without side effects. So we joined the Psychiat 2 study together with other organizations. This study looks at the use of psilocybin in cancer patients at different stages of the disease. And of course, it is interesting to see how such a study is carried out at an institute like ours. And it was thanks to my colleague Leos Ševčík, and he was very perseverant, and he simply made it happen despite the resistance of many of our doctors, or maybe not resistance, but just hesitance or hesitations, because people were wondering why we should start using drugs in our institute, and then maybe we would induce states in patients, and then we wouldn't know what to do with them later. Of course, this is just an anecdote, but this was basically what happened, and thanks to Mr. Horáček and thanks to the willingness of our director, it actually happened, and we found the right format, and this study will take place at our institute. We have already discussed this study, so I will discuss it no further, but right now we are glad that we are part of it, and we already have one patient who subscribed, who gave us her approval for this study, And we also have more applicants now that we have published the press release and informed about the study. It is probable that not all of the applicants will actually be part of the study, but it is good to see that there is a lot of interest in it. And it is very probable, very likely, that we will be able to carry out this study with success. So right now it is up to us to provide evidence that this therapy works, so that we can later obtain public financing for it. We need to provide precious data that will help psychedelic-assisted therapy to become an integral part of cancer treatment. So please cross your fingers for us. Thank you for your attention.